Okay, is there a right to health care? And if so, what does it encompass? By Norman Daniels. Daniels argues for a strong right to health care, deriving it from John Rawls's justice principle of fair equality of opportunity. He reasons that disease and disability diminish people's normal species functioning and thus restrict the range of opportunities open to them. Since people are entitled to fair equality of opportunity and adequate health care can protect or restore their normal range of opportunities, they have a positive right to adequate health care. So just quickly, in this section there are 4 subsections: legal versus moral rights to health care, positive versus negative rights, how it relates to health care, theories of justice and rights to health care, and in this section he's going to discuss libertarianism and utilitarianism, how those theories apply to a right to health care, and then equal opportunity and a right to health care. Okay, and then there's a second section, what does a right to health care include? Is there a right to health care? Legal versus moral rights to health care. One way to answer this question is to adopt the stance of legal positivists, who claim that there are no rights except those that are embodied in actual institutions through law. We would then be able to reply that in nearly every advanced industrial democracy in the world, there is a right to health care, since institutions exist in them that assure everyone access to needed services regardless of ability to pay. The notable exception is the United States, where many poor and near poor people have no insurance coverage for, and thus no assured access to, medically necessary services, although by law they cannot be denied emergency services. The legal right to health care is embodied in a wide variety of types of healthcare systems in other countries. These range from national health services, where the government is the provider of services, as in Great Britain, to public insurance schemes, where the government finances services, as in Canada, to mixed public and private insurance schemes, as in Germany and the Netherlands. Despite these differences in the design of systems, there is a broad overlap in the scope or content of the legal right to health care in these countries. Most cover medically necessary services, including a broad range of preventative, curative, rehabilitative, and long-term care for physical and mental diseases, disorders, and disabilities. Most include uses of medical technologies that enhance otherwise normal functioning or appearance, such as purely cosmetic surgery. The legal rights vary in significant ways, however, for example, in the degree to which they cover new reproductive technologies or in the types of mental health and long-term care services that are offered. In the context of rising costs and the rapid dissemination of new technologies, there is growing debate in many countries about how to set limits on the scope of a right to health care. This debate about the scope of rights to health care pushes moral deliberation about such a right into the forefront, even where a legal right is recognized. Legal entitlements, most people believe, should reflect what society is morally obligated to provide by way of medical services. What then is the basis and scope of a moral right to health care? A right to health care is a positive as opposed to a negative right. Put simply, a positive right requires others to do something beneficial or enabling for right bearers, whereas a negative right requires others to refrain from doing something, usually harmful or restrictive, to right bearers, that is, someone who holds the right. To say that others are required to do something or to refrain from doing something is to say that they must so act or refrain even if they could produce more good or improve the world by not doing so. For example, a negative right to free expression requires others to refrain from censoring the expression of the right bearer, even if censoring the speech would make a better world. Some public health measures that protect people against interference with their health, such as environmental protections that protect people against polluters of air, water, and food sources, might be construed as requirements of a negative right. More generally, however, a right to health care imposes an obligation on others to assist the right bearers in obtaining needed and appropriate services. Specifically, claiming a right to health care includes these other claims. Society has the duty to its members to allocate an adequate share of its total resources to health-related needs. Society has the duty to provide a just allocation of different types of healthcare services, taking into account the competing claims of different types of healthcare needs. Each person is entitled to a fair share of such services, where a fair share includes an answer to the question, who should pay for the services? Healthcare rights thus form a part of a broader family of positive welfare rights that include rights to education and to income support. Because positive rights require other people to contribute their resources or skills to benefit right bearers, rather than merely refraining from interfering with them, they have often been thought more difficult to justify than negative rights, and their scope and limits have been harder to characterize. Theories of justice and rights to health care. If we are to think of a right to health care as a requirement of justice, then we should look to more general theories of justice as a way to specify the scope and limits of that right. On some theories of justice, however, there is little basis for requiring other people to assist others by meeting their health care or other needs. Libertarians, for example, believe that fundamental rights to property, including rights to personal assets such as talents and skills, are violated if society coerces individuals into providing needed resources or skills. Libertarians generally recognize an imperfect duty to act beneficently or charitably, but this duty involves discretion. It can be discharged in different ways that are matters of choice. People denied charity have no right to it and have no complaints against people who act charitably in other ways. Though some have argued that the difficulty of coordinating the delivery of charitable assistance might justify coercive measures, and others have tried to show that even libertarians must recognize some forms of welfare rights, most libertarians resist any weakening of the property rights at the core of their view. A specter sometimes raised by libertarians against the idea of a right to health care is that such a right is a bottomless pit, since new technologies continuously expand the scope of medical needs. A right to health care would give rise to unlimited claims on the resources of others. Protecting such an expansive right to health care would thus not be compatible with the function of a libertarian minimal state to assure the non-violation of rights to liberty and property. Okay, number 2. Though there remains controversy about whether utilitarians can provide a basis for recognizing true moral rights, there are strong utilitarian arguments in favor of governments assuring access to at least some broad range of effective medical services. Preventing or curing disease or disability reduces suffering and enables people to function in ways that contribute to aggregate welfare. In addition, knowing that healthcare services are available increases personal security and can strengthen the ties of community. Utilitarians can also justify redistributing the burden of delivering these benefits to society as a whole, citing the decreasing marginal utility of money to support progressive financing of healthcare services. Beneath these quite general arguments, however, there lies a more specific controversy about the scope of utilitarian entitlements to health care. There seems to be little utilitarian justification for investing resources in healthcare if those resources could produce more net welfare when invested in other things, yet many people believe that they have a moral obligation to assist others with their healthcare needs, even at a net cost and utility. That is an overall decrease in happiness or welfare. For example, some highly expensive and effective medical treatments that most people believe should be offered to people might not be cost beneficial and thus not defensible on utilitarian grounds. Similarly, many forms of long-term care, especially for those who cannot be restored to productive social activity, are also difficult to defend on utilitarian grounds, yet we insist our healthcare systems are obligated to provide such services. Lack of moral acceptance of the distributive implications of utilitarianism makes many uncomfortable with the use of methods such as cost-effectiveness analysis that are intended to guide decisions about resource allocation in healthcare. For example, an assumption of cost-effectiveness analysis is that a unit of health benefit, such as a quality-adjusted life year, quality, is of equal value or importance regardless of where it is distributed, that is, to whom it is given. But this assumption does not capture the concerns many people have about how much priority to give to the sickest patients, and it also does not capture the concerns many people have about when aggregating modest benefits to large numbers of people, it outweighs the moral importance of delivering more significant benefits to fewer people. 2 points about a utilitarian framework for a right to health care are worth noting. 1, recognizing a right to health care is compatible with recognizing limits on entitlements that result from resource scarcity and the fact that there are competing uses of those resources. Consequently, recognizing a right to health care need not open a bottomless pit. Second, just what entitlements to services follow from a right to health care cannot be specified outside the context of a system properly designed to deliver health care in a way that promotes aggregate utility. That is a healthcare system. For the utilitarian, entitlements are system relative. The same 2 points apply to other accounts of the foundations and limits of a right to health care. Because many people reject the utilitarian rationales for health care and other welfare rights, theorists have explored other ways to ground such rights. Some claim that these rights are presupposed as enabling conditions for the exercise of other rights or liberties, or as practical presuppositions of all views of justice, or as ways of avoiding vulnerability and exploitation. One approach that has been developed in some detail views a right to health care as a special case of a right to equality of opportunity. This approach shows how the most important contractarian theory of justice, Rawls' account of justice as fairness, can be extended to the problem of health care, since that theory gives prominence to a principle protecting equality of opportunity. Without endorsing that account here, we shall use it to illustrate further the complexity surrounding the concept of a right to health care. Okay, equal opportunity and a right to health care. The central observation underlying this account of a right to health care is that disease and disability restrict the range of opportunities that would otherwise be open to individuals. This is true whether they shorten our lives or impair our ability to function, including through pain and suffering. Healthcare in all its forms, whether public health or medical, preventative or acute or chronic, aims to keep people functioning as close to normally as possible. Since we are complex social creatures, our normal functional capabilities include our capabilities for emotional and cognitive functioning, and not just our physical capabilities. Healthcare thus preserves for us the range of opportunities we would have were we not ill or disabled, given our talents and skills. The significant contribution healthcare makes to protecting the range of opportunities open to individuals is nevertheless limited in two important ways. It is limited because other things, such as the distribution of wealth and income and education, also profoundly affect equality of opportunity. It is also limited because healthcare, by restricting its aim to protect normal functioning, leaves the normal distribution of talents and skills unmodified. It aims to help us function as normal competitors, not strictly equal ones. Some argue that an equal opportunity account of healthcare should abandon the limit set by a focus on normal functioning. They claim our concerns about equality, including equality of opportunity, require us to use healthcare technologies whenever doing so would equalize opportunity for welfare or equalize capabilities. For example, if through medical intervention we can enhance the otherwise normal capabilities of those who are at a competitive disadvantage, then our commitment to equality of opportunity requires us to do so. Obviously, this version of an equal opportunity account would vastly expand the moral requirements on medicine, yielding a right to healthcare much more expansive than any now embodied in actual systems anywhere in the world, and arguably one that would make administration of a healthcare system unwieldy. This expansive version of the appeal to equal opportunity ignores an important fact about justice. Our concern for equality must be reconciled with considerations of liberty and efficiency in arriving at the overall requirements of justice. Such a reconciliation seems to underlie the limits we commonly accept when we appeal to equality of opportunity. We generally believe that rights to equal opportunity are violated only if unfair social practices or preventable or curable diseases or disabilities interfere with the pursuit of reasonable plans of life within our society by making us lose competitive advantage. We accept, however, the fact that the natural distribution of talents and skills working in an efficient market for them will both enhance the social product and lead to inequalities in social outcomes. A just society will try to mitigate the effects of these inequalities and competitive advantage in other ways than by eliminating all eliminable differences in capabilities. For example, on Rawls' account, transfers that make the worse off in society as well off as they can be mitigate the effects on equality of allowing the natural distribution of talents and skills to enhance productivity. In what follows, the account of a right to health care rests on a more limited appeal to equal opportunity, one that takes the maintenance of normal functioning as a reasonable limit.